We are back at the UEG TV studio here in beautiful Barcelona with another very lucky winner of a top abstract award, and that is William Waddingham. It's not Waddingham, it's Waddingham. You're a clinical research training fellow at the Research Department of Pathology, Cancer Institute Faculty of Medical Science, University College London.
Yes.
Now, first of all, congratulations.
Thank you very much.
To your award. Well done, and your successful abstract is titled Defining the Clonal Origin, Expansion Rate and Clonal Diversity of Intestinal Metaplasia in the Helicobacter-infected human stomach. Now, tell us a little bit about your study, what you did and what your findings were.
Okay, thank you for the introduction. So we were interested in looking at the very earliest point in stomach cancer development. The reason for choosing this as a topic was that there's still a big gap in our understanding as to which patients go on to develop cancer after being infected by H. pylori, the bacteria. And so our motivation was to try to study the progression before cancer, to try to get more of a quantitative understanding of what happens over time, hopefully to then inform future risk prediction to detect cancer earlier. So what we did was we looked at patients who developed cancer but took tissue from the rest of the stomach that wasn't tumour, and also from patients who were having weight loss surgery for benign conditions. And then we've been studying the precursor state, so something called intestinal metaplasia, and looking at how that is born within individual cells and glands and how it spreads. We then performed sequencing experiments to study the changes within the cells at a molecular level. So the results hopefully will form the basis for developing a model to predict over time what happens in patients' stomachs.
So this could contribute to a better understanding of oncogenesis of gastric cancer, and maybe would it make it easier to diagnose gastric cancer in a more earlier stage?
So we hope so, and actually in the group that I work, we're also undertaking some endoscopy studies. So we believe that by targeting the biopsies at upper endoscopy to the lesions, so to the intestinal metaplasia, and by focusing those biopsies, that will give a more accurate diagnosis to start with. And if that can be combined with molecular tests to look for markers of cancer risk, then the two of those together should enable more of a patient-specific, patient-tailored way of measuring their risk at an individual level.
So did you look for specific biomarkers?
So we have, and the hypothesis was that because this is a patchy condition where you've got multiple regions within the stomach affected, we believe that the diversity between these areas is actually the indicator for how far these lesions have progressed. So we believe that the genetic diversity within a patient's stomach, so how different these regions are, could correlate with cancer risk. And actually, from the study that I've presented so far, we're taking this data forward to a larger scale study to try to validate that finding in patients undergoing endoscopic surveillance.
So early diagnosis of gastric cancer is still an unmet need, especially I think in resource poor settings. So your scientific work might contribute that we someday have better tools.
Well, I very much hope so, and it may be that there's a lot more validation work to do, and I think in order for a molecular test to get to the clinic, it would have to be validated prospectively. But we'd like to think that the results so far could at least form the basis for designing future studies in more of an intelligent, sort of patient-tailored way. Yeah.
Very good. William, thank you for being here. It was nice talking to you.
Thank you for
and congratulations
me.
Again. Thank you very much.
Thank you to you, and thank you to UEG for the honour of the award. Thank you.
Thank you.